medicine, it has many wonderful features, is that at least the way it's communicated in this country is that it assumes that people are lazy and uninterested in their own health. And I fundamentally disagree, hence this podcast, your podcast, et cetera.
I agree too.
I believe people want and are willing to take care of themselves if they know how. Mm-hmm. Okay, so let's just assume that the pillars of health, right, like sleep, sunlight, exercise, nutrition, social connection, stress modulation, microbiome,
yes,
et cetera. Okay, assuming that people are making some effort to do those things correctly or a lot of effort, what are some of the things that you believe cannot be accessed through diet and behaviors that warrant supplementation? And I've been interested in supplements and taking supplements for 35 years. So to me, when people say, oh, supplements aren't regulated, I say, actually, they are regulated to some extent, right? Like they're monitored. You want to find ones that are third-party tested. Indeed, there are a lot of junk supplements out there. There are probably a lot of supplements that don't do much. There are probably a lot of supplements that are only use cases for certain people who have a major deficiency. But what are some of the things that are just very difficult to get from food and from sun? Because we hear, the soil's depleted of magnesium. It's hard to get enough D3. Like if you were to list out, let's just say about 10 things that you feel like, listen, you probably could get it from food, but it's just hard to get these micronutrients. Yeah. What are those things? And by the way, folks, this is not a preloaded conversation. We've never had this conversation. No. I know what I take, but I'm just curious. What would you – because people will try hard to get things from food.
Yeah.
But what are the things that they can't get from food or can't get from food easily that you believe everyone should take?
Great question. I thought you were going somewhere else. I thought you were going where – what are the things that if you did everything perfectly and you're still sick, what do you do?
Oh, well, right? We'll get to that. We'll get to that.
There's a list of those things.
We will get to that.
80% of it you can take care of, but there's some things you need help. We can talk about that.
Yeah.
I think because of how dramatically our diets changed after the Industrial Revolution and because of urbanization and our disconnection from nature, we have a lower nutrient intake than we did as hunter-gatherers. I just came back from Africa and went to the Hadza tribe, which is one of the last hunter-gatherer tribes, and I got to spend a few days with them. And the nutrient density of the diet was so much higher. Omega-3s, vitamin D, you're outside running around on a loincloth, or if you're not, you're living in some coastal area where you're eating extremely fatty fish, which is one of the great sources of vitamin D in the food. They were eating phytochemicals at an incredible rate through eating 800 different species of plants. Now we have 3 main ones, and 12 of them are altogether comprise probably 95% of our diet instead of 800 plants with all kinds of phytochemicals and vitamins and minerals. The soils we're growing food in have depleted the organic matter because of industrial farming and soil erosion. And the organic matter, the living soil, is what actually helps to allow the plants to take up the nutrients from the soil so that there's a symbiotic relationship between organisms in the soil and the plant, and it uses them to help get nutrients free so they get into the plant. So where there's less magnesium, there's less zinc, there's less all these things in our diet. And when you look at the surveys of the American population, there's an ongoing government survey called the National Health and Nutrition Examination Survey. And essentially goes around the country with vans, tests people's blood all the time. And this is like decades-old survey. And it's incredible because you get all this data. They find that like 90+% are low in omega-3s, probably 80% are insufficient or low in vitamin D, 50-something% are magnesium deficient, about the same iron, zinc a little bit less, selenium a little bit less. And it depends on where you live and what you do, and also depends on your diet, so, and what your stage of life is and what your age is and how your absorption is. For example, when you're older, you get decreased ability to absorb nutrients and decreased ability to absorb, for example, vitamin B12. So at different ages, you might need different things, right? And so what are the basics that I think everybody should take? I think everybody should take omega-3 fats, at least a gram or 2 of EPA DHA. Most people need between 2,000 to 4,000 international units of vitamin D3. I think a good multivitamin can cover the rest for most people. And when I say good multivitamin, I mean one with the right bioavailable forms of nutrients. I was in the hospital recently for back surgery, and this resident came by and he was, attending, saying, well, I said, I think I need some magnesium because I'm taking all these painkillers for my surgery and I don't want to be constipated. He says, oh, you can get this one. I said, that's magnesium oxide. That's not well absorbed and it doesn't not the greatest for
Eating magnesium citrate.
Yeah, so I said, and he was like, "Oh, that's really interesting. I didn't know that." He wrote it down. But like, so I think
Yeah, I have a lot of friends who are physicians, and I'll tell you, they come to me for health advice. So that tells you something.
That's right.
I'm not an MD. Yeah, folks, magnesium citrate, great laxative.
Yeah,
malate for muscles, glycinate and threonate for brain and sleep.
Yeah, and glycinate for also if you're not tending to be constipated, it's one that you can tolerate and not be constipated. It also helps with detoxification and sleep and other things. So, and so those are the big ones. And I think, I've been diagnostically testing people for decades of nutritional testing. With Function, we do deep nutritional testing, including omega-3 testing and homocysteine, looking at methylation, which is a really important thing you've talked about in the podcast, B12, folate, B6. We do vitamin D testing. And we see over 67% are deficient. And this is important to understand, Andrew. 67% are deficient at the minimum level to prevent a deficiency disease, not the optimal level that you or I might think is good, like vitamin D over 45 or a ferritin iron store over 45. They're like, oh, if your vitamin is 30 or more, you're okay. Or if your ferritin 16 or more, you're okay. Well, if you're ferritin 16, you're going to be tired, you're going to have brain fog, you could potentially have hair loss, you could have insomnia, and that's just having low iron stores. And so when we're looking at that, we're like seeing what an incredibly depleted population we are in terms of the nutrients we have. So I wish we wouldn't need them, and I wish we didn't need them. But the fact is that unless we're eating a very structured diet, and I had a patient once who had OCD, and she's like, I don't want to take any vitamins. I said, okay. She says, but I'm going to eat. I know there's pumpkin seeds have zinc, so I'm going to have like 14 pumpkin seeds a day, and I need 200 micrograms of selenium. So I'm going to take 4 Brazil nuts a day. And she went on and on like, I know I need this nutrient, so I'm going to have this much liver a day. And so she was able to figure it out, but it's not easy. No.
So it sounds like magnesium, getting a gram of EPA omega-3, 3,000 IU minimum of D3 per day, some iron, some zinc, selenium. Sounds like the basics.
Yeah.
And would that be true for teens?
Well, for example, you're an older guy. You don't want to take a lot of iron because you're not getting rid of it, and you can get iron toxicity. So if you're a menstruating woman, you need more iron. So, but what I think is the key is figuring out what's right for you. Test, don't guess. Most people don't know, and some people may need 10,000 units of vitamin D to get the same blood level as somebody else with 1,000, and that's because there's different vitamin D receptors, and they're genetically determined, and you can't know by just guessing.
Right. I totally agree, but I also totally know that a lot of people won't blood test. So the argument against supplements has always been you just are creating expensive urine, which is a silly one because that's based on water soluble vitamins only, right?
Sure. And by the way, it's a stupid argument because you're like, why drink water? I just pee the rest out. Right. While I'm creating,
it's silly. It's a silly one. But the list that we just talked about: D3, omega, magnesium, maybe some iron if you're not an older guy, zinc, selenium. It seems to me those would be good things for most everybody to add to their already healthy diet that has enough prebiotic, postbiotic fiber.
And we're seeing iodine interesting because people are eating iodized salt. So they're having sea salt and Himalayan salt.
We got too fancy with our salt.
And so
we need table salt.
We're not eating iodized salt. Now, iodine is not normally found in salt, but it was added to salt as a fortification to prevent goiters or thyroid problems. But a lot of people have thyroid issues. 1 in 5 women and 1 in 10 men have low thyroid function, and 50% are not diagnosed. And sometimes just a little iodine supplementation can help. Or you can eat seaweed, or fish. But a lot of people don't eat seaweed or fish.
Right.
So, that's how you would get iodine otherwise. So I think people need to kind of figure out what's going on with themselves and based on their diet and their preferences. And if you're a vegan, I think we're seeing tremendous deficiencies in vegans if they're not supplemented.
We hear a lot nowadays about methylated B12. I decided to just start taking methylated B12. Is there a danger to taking methylated B12 if you, quote unquote, don't need it, if you're not a poor methylator?
It depends on what you're taking. Mostly not, but you can over-methylate or under-methylate. And so you don't want to be doing too much of either or the other. And there's genetics that are involved in actually assessing how your methylation pathways work. So the genetics are around B12, around B6, around folate, and you have multiple genes that regulate all these different pathways. So it depends is the answer. But for most people, taking a good multivitamin, and when I say good, I mean It doesn't have any fillers or binders or additives. It's not blue. It doesn't have titanium dioxide in it. It has forms of the nutrients that actually can get utilized and absorbed better by the body. We talked about magnesium oxide versus glycinate or citrate. And that you make sure the company has integrity, that they've third-party tested for the purity and the potency, meaning if it says 1,000 units on the label, it's 1,000 units, not 10,000 or 2,000, and then it doesn't have any cross-contamination with additives or chemicals. So sometimes, you get something with an herbal product that comes from China, the company didn't realize it was full of lead or whatever, now we're seeing all these plant proteins with lead in them.
Yeah, I want to make sure that we talk about the impediments, things like mold, air, water, cleanliness.